How to Looksmaxx your baby.
Looksmaxx your baby.
Because if you are already cooked, your child doesn't have to discover maxilla development through clavicular, Reddit, and a surgery payment plan. And no, I don't mean putting retinol on a newborn. Please don't. I mean that a lot of facial development starts way earlier than people think. Before braces, fillers, and jaw surgery, before grown men start asking TikTok if they have hunter eyes. First, head shape. Babies are born with soft skulls because nature looked at childbirth and said, let's make this slightly less impossible. But that also means if a baby spends too much time with pressure on the same side of the head, the skull can become flatter or more asymmetrical. So yes, rotate the tiny potato. Use tummy time when they're awake. Carry them, change their head position. But important, babies still sleep on their back. We are preventing flat heads, not ignoring safe sleep rules. Second, breathing. If a child chronically breathes through their mouth because of a blocked nose, enlarged adenoids, allergies, or airway issues, it can affect how the tongue rests, how the jaw sits, and how the face grows. That tired, open mouth, Victorian orphan look, sometimes that's not just genetics, sometimes it's airway. So for breathing, the baby Looksmaxxing goal is not teach your newborn mewing. The goal is simple. The baby should usually be able to breathe comfortably through the nose, rest with the mouth gently closed, and have the tongue naturally resting up toward the palate. Third, bite and jaw. Your bite is not just about cute teeth. It affects your smile, your profile, chewing, speech, breathing, and how 3D your face looks. And this is where early habits matter. If a child sucks their thumb for too long, uses a pacifier for years, loses baby teeth too early, has untreated cavities, or only eats very soft foods when they're old enough for more texture, the teeth and jaws may not develop in the most balanced way. And feeding matters too. A proper latch makes the baby use the tongue, lips, and jaw muscles differently. Bottle feeding matters too. A good bottle latch should pass the so-called triangle test. The baby should have a deep, wide latch with the mouth around the nipple base, not just shallow sucking the tiny tip like they're drinking from a sad plastic straw. So the actual baby Looksmaxxing routine is making sure your baby can breathe well through the nose, latch, and feed properly, use their mouth and jaw well, keep their baby teeth healthy, chew age-appropriate textures later, and get checked early if they snore, mouth breathe, lose teeth too early, or look like their tiny airway is fighting for its life. And if something looks off, don't wait until your child is 25 watching how to fix recessed maxilla videos at 3 a.m. Ask a pediatrician, a dentist, or an orthodontist, because real Looksmaxxing starts when you're still tiny milk-drunk potato. So yes, while it might be too late for some of us, but your baby does not need to enter adulthood with a hard-maxing arc, a Reddit diagnosis, and a jaw surgery consultation. Rotate the chunky and jobless potato, and please, do not let your child discover clavicular, ever.